In America, you can do everything right. Insurance, steady job, no wild spending habits, and still end up in debt. Not because you bought something, because you got sick. That's not a metaphor, that's the actual system. Medical debt is the single largest source of debt collection in the entire country. Bigger than credit cards, bigger than utilities, bigger than any other category combined. Somewhere around 100 million Americans are currently dealing with it in some form. And here's the detail that should really bother you. Over 90% of the people carrying this debt already had health insurance when it happened. Insurance was supposed to be the safety net. Turns out, the net has some very expensive holes in it.
Let's just sit in the numbers for a second, because they're genuinely wild. Americans currently owe at least $220 billion in medical debt. Roughly 1 in every 12 adults in the country owes something. Of those, about 3 million people owe $10,000 or more. Not from a house, not from a car, from a hospital visit. And medical debt isn't evenly spread out either. It disproportionately hits lower-income households, uninsured or underinsured people, and, worth saying plainly, Black and Hispanic households at meaningfully higher rates than white households. This isn't random bad luck distributed equally. It tracks who already had the least room to absorb a shock in the first place. Here's the number that actually explains why this debt is so different from every other kind. Medical debt is now linked to roughly 2/3 of personal bankruptcy filings in the U.S. Not credit cards, not car loans, not "I overspent on vacations," getting sick. You don't rack up a $90,000 ICU bill because you made a bad financial decision. You rack it up because your heart stopped for 4 minutes and someone in scrubs had a very good day at work.
Here's the part that makes medical debt so uniquely brutal. It's not optional in the way other debt is. If you can't afford a car, you don't buy the car. If you can't afford a vacation, you skip the vacation. Nobody's card gets declined and then dies. But if you're having a heart attack, there is no "let me check my budget first" moment. Emergency rooms are legally required to treat you regardless of ability to pay. But that requirement is about treatment, not about the bill that shows up 6 weeks later with a return address you don't recognize. And even having insurance barely changes the math anymore. High deductibles mean you can be fully insured and still owe thousands before your coverage even kicks in. Nearly half of Black adults and almost 40% of white adults report genuine difficulty affording healthcare, insurance or not. Then there's the pricing itself, which operates in what can only be described as an alternate economic universe. The same MRI can cost $400 at one hospital and $4,000 at another, 20 minutes away, for the exact same machine doing the exact same scan. There's no menu, there's no receipt before the transaction. You find out the price after the service has already happened, which is a business model that would get literally any other industry sued into oblivion. Imagine a restaurant that wouldn't tell you what the meal costs until after you'd already eaten it, and also you were unconscious for the ordering process. Once the bill goes unpaid, it doesn't just sit there quietly. It enters what's basically an entire industry built specifically around this exact kind of debt. Hospitals, sometimes directly, sometimes through debt collection agencies they sell the debt to for pennies on the dollar, pursue medical debt the same way any other creditor would. Calls, letters, and critically, credit reporting. Getting sick could tank your credit score, which then affects your ability to rent an apartment, get approved for a car loan, or in some states, even get certain jobs. Let that sit for a second. A health event you had zero control over could quietly follow you around for years through your credit report, long after you've recovered. There has been some pushback. As of early 2026, roughly 15 states have moved to limit medical debt from appearing on credit reports at all. The Consumer Financial Protection Bureau even proposed a federal rule to strip medical debt off credit reports entirely.
But, and this is very on brand for how these things go, that federal rule got tied up and blocked in court, so the fight shifted back down to individual states instead of getting solved once, nationally. Translation: whether a medical bill can wreck your credit score currently depends on which state you happen to live in. Your zip code decides how much your illness is allowed to cost you.
Because the debt itself is often unavoidable, people get creative, and not in a good way, about how they cover it. An estimated $44 billion gets pulled out of retirement accounts every single year specifically to cover healthcare costs insurance didn't handle. Money meant for someone's future at 65 gets drained at 35 because of a surprise surgery. Some people put medical bills directly on credit cards, trading a 0% interest hospital bill for a 24% interest credit card balance, which is a genuinely terrible trade that people are functionally forced into. There's also an entire cottage industry now of medical debt consolidation companies, services that will negotiate your bill down or combine it into one manageable payment, for a fee, of course. Which means there are now businesses whose entire revenue model is helping people survive a problem that a slightly different healthcare system wouldn't have created for them in the first place. It's a repair industry for a car nobody wanted to crash. Even Arizona and the city of Toledo took a more direct approach, literally buying up bundles of residents' medical debt from collections agencies for pennies on the dollar, the same way debt buyers normally do, except they did it to cancel the debt instead of collect it, which is a genuinely creative fix and also a slightly bleak sign of how broken the baseline system is when the solution requires a city government to functionally rescue people at auction. One of the strangest parts of this whole system is just how differently it plays out depending on where you live. In states with expanded Medicaid coverage, medical debt rates are dramatically lower. In states without it, the numbers can be 5 to 7 times higher for otherwise similar populations. Hawaii sits at roughly 2% of adults carrying medical debt. Certain southern states sit well over 12%. Same country, same illnesses, wildly different financial outcomes, because healthcare in America was never actually built as one unified system. It's 50 different experiments running at once, and some of them are going noticeably worse than others. So the honest answer to how much will getting sick cost you isn't really about your health, it's about your address. Step back far enough and the pattern gets uncomfortable. Medical debt isn't really a story about people making bad choices. It's a story about a system where the price of staying alive is opaque, wildly inconsistent, and often only discovered after the fact, and where the financial fallout from that gets treated exactly the same as if you'd maxed out a credit card buying things you didn't need. Every other kind of debt on your credit report tells a lender something about your decisions. Medical debt mostly tells them you had a body, and that body occasionally needs things fixed. That's not a financial character flaw. That's just being a person. And yet, for now, it's still filed under the same system as every other kind of financial failure, which is either a massive oversight or exactly how someone wanted it to work. So the next time someone says medical debt is just part of adult responsibility, remember, you don't get a quote before the ambulance shows up. You don't get to shop around mid-seizure. The bill just arrives afterward, in a system that priced the whole thing out while you weren't exactly in a position to negotiate. Getting sick isn't a financial decision. In America, apparently, it's treated like one anyway.